tenemos con nosotros a Ingmar Hoerr, biólogo alemán y pionero en la investigación de vacunas en relación con el uso del ARN mensajero. Ingmar es uno de los fundadores de la empresa de biotecnología alemana CureVac, que la semana pasada presentó unos resultados de efectividad por debajo de lo esperado, pero esto es algo que, lejos de ser excepcional, es una de las posibilidades cuando se investiga el desarrollo de cualquier vacuna, cualquier fármaco innovador, que en todo caso no va a afectar al buen avance de la vacunación en Europa, ya que se espera que el 70% de la población adulta esté inmunizada a mediados de agosto. Hola, señor Hoerr. Antes que nada quería preguntarle cómo se encuentra, porque hace casi un año usted sufrió un aneurisma cerebral, fue justo al inicio de la pandemia.
Yes, I get an aneurysm in my brain last year, so I was kept in the hospital and was completely unconscious, so I couldn't remember anything all the time. So I was in a coma, and I was waking up maybe 2 months later. So, and I was really in the hospital all the time and not knowing what was going on. I even didn't notice the COVID pandemic scenario since I was kept also alone in my room. So I was just coming back in June when I was going into another hospital. And then I was there when CureVac was doing the IPO in autumn.
¿Y cómo ha simultaneado la recuperación personal de ese aneurisma y su participación activa como científico en la lucha contra el virus, contra el SARS-CoV-2?
Well, now I'm back to life, I have to say. So it's very good. I did a very good progress, and well, yeah, it's overwhelming to see what happens, and I'm so happy that RNA vaccines, they work with BioNTech and Moderna. So I really have hope that also the CureVac vaccine will work the same.
¿Se esperaba usted que la tecnología del ARN mensajero alcanzara una aplicación global en un periodo tan corto, es decir, apenas un año desde el inicio de la emergencia sanitaria?
Well, actually, when we founded CureVac in 2000, so 21 years back, I was aware about that already. Yeah. So, but we didn't have any data. I was just knowing that this technology can do a lot of things and can be easily produced and is also effective in inducing immune responses. So at the beginning, I knew that, and therefore it gave me a lot of strength to fight for that, because it wasn't known to the investors, so they didn't believe in this technology. But I personally know it from the beginning.
Y en el proceso de combate contra la COVID-19 en CureVac, ¿cuáles han sido los principales aprendizajes o los principales retos que han tenido ustedes que afrontar?
Well, the biggest learnings was just the pressure, the time pressure everybody had at that time. So CureVac also took time to develop the vaccine and start clinical trials, get funding, getting IPO. So there were a lot of things to do at the beginning for the company. And and I'm really happy that this company achieved so much. And I hope that we soon get the data from the clinical trials and we get an approval like the others. And I'm quite hopeful that it's coming soon.
¿Y cómo describiría la cooperación entre el sector farmacéutico y los gobiernos, las administraciones?
Well, yes, it was very helpful. So at the very beginning, we had a governmental funding. Without that, we would have been insolvency. So we wouldn't have been bankrupt. So that was very important. And then we also learned a lot in collaborations with different pharma companies. This was also important to have really common goals. We had to achieve funding, which was very important, and also the funding with the Gates Foundation. This was also very important to do these basic researches. It was very important to develop the basic research before we getting into products. And this, I think, is a very big strength of CureVac, that the basic research was done rigorously in many years, and we test a lot of different constructs. So therefore, it enables us to adapt very easy to the current circumstances in terms of the vaccine production.
¿Y qué futuro le ve a la tecnología del ARN mensajero en este momento de su desarrollo?
Well, it's just the beginning. So the COVID vaccines are just the beginning for a new century of pharmaceutical developments. It's not only vaccines. In my eyes, also very important from the very beginning was always cancer, because cancer is a very deadly disease. So many people die from cancer. And I think there are opportunities to prolongate the lives of these patients for a longer time. So therefore, I am really hopeful that cancer can be treated by RNA vaccines, and also other products coming up, like enzyme deficiencies, for example. So there are many, many ways coming up, and I think these COVID vaccines are just the beginning of a new era of pharmaceutical development.
Y permítame que le pregunte, según su experiencia, ¿qué consejo le proporcionaría a la industria española de biotecnología?
Well, if you really believe something, if you believe in the data, what you see, never give up. Always fight for that, and never, 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 ever give up. Just try to get as many data you can. Try to improve your technology, but be really on track. I think there's a real danger that people and founders, which are not from the pharma perspective, which don't have the experiences of big pharmas, that they give up too early. So really, you will make failures for sure, but you have to overcome this situation and never, never give up.
Bien, pues con este último mensaje nos quedamos. Nunca hay que rendirse. Muchísimas gracias, señor Hoerr. Muchísimas gracias por querer estar aquí hoy con nosotros.